All right, the meeting recording is started.
Hi, everyone. This is Lindy Hinman, President. I call to order the Boulder County Board of Health regular meeting. It is Monday, January 12th. Can all other board members announce yourself, please? I am Morgan McMillan, board member.
Hi, this is Stephen Yoon, board member.
Landry, I think we can't hear you, but I saw that you announced yourself.
Landry Fagan, board member. Sorry.
Oh, no, that's fine. Thank you. Okay, great. We do have a quorum, and I will also mention that the notice of this meeting was posted on the Board of Health website and that all call-in information and address is included to allow for public participation. We're now going to move into the agenda and we'll announce each agenda item as they come up. The first is, I believe we have somebody or some people that would like to participate in public comment. So I will ask if anyone is on the phone who would like to make a comment.
Yeah, I see Aaron Meshke on the phone. You're our only public commenter tonight, so welcome you to unmute. And if you want to turn your camera on, you can. It's optional. And give us a verbal that you're ready, and we'll start the timer. You'll have 3 minutes for public comment.
Okay, I'm here. Can you hear me?
We can.
Yes.
Wonderful. I'm not going to turn on my camera just because I couldn't put Teams on my computer, and so I'm having to use my phone for both my notes and the Teams app. So thank you for the opportunity to speak. My name is Aaron Meshke. I live in Boulder and represent myself. Last week, I received an email from BCPH with the county statement on vaccine recommendations given recent federal changes. In order to claim that previous vaccine recommendations are safe and effective, we must not only look at the reduction in specific non-lethal illnesses, but at trends in overall health. When I was a kid in the 80s, food allergies were almost non-existent. Chronic disease in children was rare. Chronic disease in adults was uncommon. Even asthma was an anomaly. Children had normal energy, but no one was diagnosed with ADHD, and there was no autism in my schools. Childhood disease rates have climbed over the 7 decades that vaccine recommendations went from 3 to over 72, and we're at all-time highs before ACIP and HHS intervened recently. If vaccines really are safe and effective, we should have the healthiest kids that have ever lived, but instead we see the exact opposite. According to the CDC, 90% of the nation's $49 trillion of annual healthcare expenditures are for people with chronic and mental health conditions. And data released last month by the Partnership to Fight Chronic Disease projects that chronic disease is on pace to cost the United States as much as $47 trillion between 2024 and 2039. Including 2.2 trillion annually in medical costs and nearly 900 billion in lost productivity each year by 2039, and also estimate that childhood chronic disease will cost the US 1.15 trillion over the next 15 years, including 620 billion in direct medical costs and 530 billion in economic losses. In addressing causes and solutions, vaccines don't even get a footnote as a potential factor. It's comical to call past vaccine schedules evidence-based when no saline placebo-controlled trial has ever been done on any vaccine. So why vaccines have gotten an automatic pass for so many decades is just beyond belief. In order to help sick people heal and healthy people stay that way, we must evaluate all factors that could be part of these declines. It is not the job of public health to propagandize for specific medical products or procedures, but claims in the January 7th email did just that. BCPH must do better because the position that vaccines can't be questioned is insufficient given the health challenges many Boulder County residents deal with every day. Thank you.
Great. Thank you so much. Are there any other public comments, Patrick?
No.
Okay. Okay, great. All right, we're going to move on to the approval of the prior month's meeting minutes. I make a motion to approve the meeting minutes from the regular Board of Health meeting on December 15th, 2025. Can somebody second? I will second. Thank you. All in favor? Aye. Aye.
Aye.
Aye.
Thank you. Motion approved. We voted all in favor. Thank you. All right, Lexi, I'm going to turn to you for the next discussion, which is policy and legislation plans for the session and what to expect.
Great.
Yeah.
Thank you very much, Lexi Nolan, Director at BCPH. And we are excited. We are about to start the legislative session on Wednesday, is it?
Yep.
Yeah, so we've got 2 days. We're counting down the minutes and a full-time person who can really support this work. Very excited about it. Tessa is here tonight to talk a little bit about what to expect during the legislative session and get some feedback from you all and make sure we're all on the same page.
Thanks, Lexi. Tessa Hale, Policy Lead for Boulder County Public Health. And I just put together an overview of what the legislative session will look like internally for staff, and then a discussion on really how to engage the board on getting involved in policy. So we can go to the first slide here. And this is really in response, I think, to the last Board of Health meeting with some requests for some details on this. So our BCPH State Policy Work Group kicked off last week. We're meeting every Tuesday from 10:30 to 11:30 a.m. during session. I'm excited that we have 15 people who have volunteered to participate and pretty much representation across all divisions. We have a new software platform called Fast Democracy that we'll be doing a training on at our meeting tomorrow. And it's a really robust system for being able to easily track what's happening, make notes, see in real time where things stand, what the votes look like. And we'll be using that to generate reports to the Board of Health. We'll have weekly policy updates going on to management team and the policy group. We'll return to this in a little bit, but we had talked about doing monthly reports to the Board of Health unless there's something urgent. There are weekly or biweekly CalPhone meetings during the session as well. So we'll be really in touch with them, and we're going to be coordinating closely with the BOCC policy team to align efforts. Slide. So this is an example of the reports that will be coming from Fast Democracy. I didn't have anything to actually share. It's a new platform and no bills have been formally entered into the system, but essentially there'll be hyperlinks for people to, if you want to do a deep dive, read a summary, see who's supporting it. There's comparisons to other legislation in Colorado and other legislation nationally. And then there's also the ability to just see anytime Boulder County is specifically called out. So it's going to be, I think, a really helpful way for us to align our efforts and stay in close communication.
And just to highlight on that one, Tessa will be sending out reports to the board with tracking of the particular bills that we're following.
Right, so we'll do all of public health related bills, and then those that fall into our priority areas will be flagged as priority so that it's easy to know what's what. And we'll also have notes on any actions that we're specifically taking in there too. So next up, this is our policy action process for how our team internally will coordinate. So essentially, the different ways policies can be brought forth is we have a request. We've already had several requests to support or advocate for specific legislation, or we'll hear of a bill, ordinance, or rule coming forward or being amended. Or when we get to the proactive piece of policy development, this will be, we've identified internally a potential policy solution. So what happens then is I manage the internal coordination. I make sure that it aligns with our policy priorities. I make sure that everyone inside the agency knows what's going on. People are on the same page. It has approval of Lexi and management team, and then externally coordinating with our partners and other community stakeholders. And from that, we'll decide, do we move forward with this? Do we move forward with some conditions around it? Or will we just watch it? Or will we just say, you know, this doesn't align with what we're trying to do, or we don't have the time and resources to take action? So we've outlined using the Gracie model for how across the continuum of the organization, people will fall into roles and responsibilities. And this is really where we see the Board of Health on policy activity. So we'll consult with you on our annual policy priority setting, identifying policy issues and opportunities. If you all want to bring things forward to us, that would be great. And then there's opportunities to collaborate on written and verbal support of specific legislation. And then we'll keep you informed really around our policy analysis, our positions on specific legislation, and then those reports that will be ongoing monitoring and outcomes. Okay, so one of the things we talked about last time was really how best do we engage the Board of Health with policy activities. And so just to level set before reaching out to the board, these are things that we would internally make sure of. We'd be sure that whatever we're bringing forward is in alignment with our policy priorities. We would have a clear position and direction that we want to go. We would have coordinated with our key partners, CALFO, policy team, other stakeholders, and then those clearly defined roles between staff and board as we take action. And we'll talk about that next, sort of in the different levels of engagement that we are thinking of for the board. So how do we decide when to engage the board? And these were sort of the 4 criteria we thought would be raised to the level of engaging, the expertise and using your time. So one would just be that whatever the legislation is, that it has a really high impact on our funding, our services, or authority generally, that if not addressed, there could be tremendous harm to the community, significant harm to the community, where the Board of Health voice has greater credibility than staff or subject matter expertise alone, or that the board has unique subject matter expertise to bring to the topic. And then also we're doing some proactive policy development where outcomes could be shaped would be another area. So if any one of those is checked off, then we think that's where we would start engaging with the board.
On the early stage, I feel like why did you guys put that one on there in terms of board threshold? I'm just curious because most policy making starts at an early, there's usually a nugget of an idea and then so yeah, just help me understand that one a little bit better.
Yeah, so and it's actually I have a slide on this at the end talking about there was an interest in maybe some proactive policy shaping by the board. And so I think there's probably 4 different ways that if board members wanted to participate in whether it's community stakeholder meetings, whether it's engaging with legislators as they're looking around to different kinds of bills that they would bring forward. I think that that's something that we would be looking at in the latter half of this year, just kind of the cadence of when I've started and where we are in the process. But it would be an opportunity if the board had a specific interest in something that we've identified that we want to develop.
Yeah, okay. And I assume that may come through the strategic planning subcommittee to a large degree in terms of things that we might want to be focusing on strategically and then how that might translate to a policy.
Yes.
Yep. I guess another example I think of is, if we have piloted a program in Boulder County and we've seen success from that within our own community and there's an opportunity to implement that more broadly across Colorado through policy, then that might be someplace where we might weigh in on that.
Yep. That makes sense also. So we think that there's really 4 different levels of engaging policy. The first is just what we've already planned and what you're familiar with, which is that we're going to track and monitor policy and continue to keep you apprised of where those things stand. The next level down would be written advocacy, where we would draft written comment. And then we have a few decisions for the board to make around this in a little bit, but then the board or an individual board member would submit a letter or a written comment. The next level would be public testimony, where again, we would prepare briefing materials and talking points, and then a Board of Health member would provide public comment. And then the next level would be
where staff coordinates a meeting for the board to meet with legislators. And so an example of this would be, we talked a lot about the public health funding cuts that are on the table, and that could be an area where it might make sense for the board to speak with representatives who are in the JBC for Boulder County. And then along the way, we'll be sure to be documenting the ways that the board are engaged. We'll have a report at the end of the year just to have a retrospective. How did it go? What was the impact? And then we'll take those lessons learned into future planning. So this is where having input would be really helpful. I think our plan currently for updating the board on legislation is just the monthly reports. And then if there's something urgent, Lexi would certainly reach out and let people know. And I just guess I want to know if that still makes sense. If there's, yes.
Yep.
Okay. Excellent.
We can go back to that.
Sure. And then in the board packet, we had made a table where there was an opportunity for board members to note their area of interest so that if we do, to our measures of engaging the board, see that there's somewhere we think we could use board support, that we know who to reach out to. So I guess I'm curious if people had a chance to look at that and if that seems to be a good way for us to identify who to engage for specific topics.
Yeah, I think that's great. And just from my perspective, making sure everyone gets back to you with their homework. Yeah. But I don't know. Yeah, I think it's straightforward and hopefully that'll help us think also about what we really want to engage on.
Great.
Yeah. And by the way, I'd love to see if it's okay to share with the rest of the board what other board members are interested in.
Yes.
That would be great.
Gather that and put it in the packet for next time.
We can put it on the Board of Health SharePoint.
Yeah, great. Thank you.
Yeah.
And then the last decision point is around when there's support or written support or testimony, does the board want that to be on behalf of the entire board or by individual board members? And I did reach out to Adams County and Jefferson County who have a dedicated policy person. And it sounds like it is on behalf of the entire board when this happens. So just wanting to see what you all think.
Yeah, I mean, I feel like if staff were to help draft something, I feel like it's totally appropriate for the board president to sign off on behalf of the full board, and we don't need to all edit or weigh in on that.
Yeah, and I would say maybe if back to the thresholds of engagement with a board, if there's somebody there's a topic where there's a board member that's particularly expert, I would suggest maybe they're the ones that are giving the testimony or whatever, whatever that sort of public piece is. Because I think that would give it more weight potentially. So maybe that's something to consider in that case.
Okay. Sounds good.
Landry, Steve, any additional thoughts on that? I just want to make sure.
No, I appreciate this approach. Thank you.
Yeah, hi. This is very helpful. I guess I am somewhat conflicted because I feel like the real expertise in a lot of these areas reside within the public health team, and the amount of input that we can provide. Obviously, there are some things that we may be more familiar with, or we can provide our thoughts and inputs. But by and large, there's so many things, and people do such a broad range of activities. I guess I'm trying to kind of figure out, are the board members really in a position in terms of our knowledge and expertise and experience to push things, or do we need to be more of a supportive role? And whether that is something that kind of agrees with what the rest of the team is thinking. I'm willing to help, but I'm not sure whether I can be of that much help in certain topic areas. And so, yeah, could you just kind of maybe think through that a little bit or explain that, your thoughts?
Sure. Yeah, I think we have tremendous subject matter expertise among staff. And so that would sort of always be our first place go to for, providing comment or, our thinking on a specific piece of legislation. But I think there are times where the political clout of the Board of Health would have carry more weight. So it's nuanced, and we would certainly talk through and weigh out where it would make sense to call on the board for that. And so I think, it's definitely on a case by case basis, but appreciate your point about the expertise of the team here and the ability to provide that. So I think, and this will be a learn as we go, but I think it's not going to be frequently that we'll be tapping the board for comment.
Yeah, just to follow on that, I thank you for that clarification. I think, it does help sometimes to get a outside of the box perspective, and I think that's something we could obviously provide, because oftentimes when you're down in the weeds, you sometimes miss the big pictures, or sometimes you may not see it, and that'll be the kind of situations where we can be, I think, of help. So I appreciate your comment about kind of learning things, as we do things and figuring out how to most optimally use our input. It's not that, I don't want it to sound like I don't want to do it. I just want to make sure that whatever that I'm doing is useful to the rest of the team. Thanks.
Thank you. And that's actually the perfect segue to my last slide, which is proactive policy engagement. So, I think that this is where we could use those new perspectives, not being in the weeds. So there's 4 distinct areas where the board could get engaged. And this is something we can revisit. Like I said, this will be 6 months out as we continue to build out our policy work, but we're planning to have community listening sessions. That would be a place if board members wanted to come and be part of a facilitated conversation. We'll be proactively developing policy. And so in those early stages, as we're thinking it through, we would welcome board member participation. We'll have annual policy planning strategies, and this could be another way where the strategic guidance from the board would be helpful. And then lastly, especially we're moving into local policy engagement, if the board was interested in meeting with stakeholders, wanted to help as we're convening folks, or if we host mayors from different municipalities to talk about specific public health issues, this would be a place for board members to engage as well.
Yeah, I think I was talking to Lexi about this in a different context, but I think we all know the board, this is not their day job. And so what I would suggest is, and I really appreciate what you said about this, you're not going to engage the board all the time on, engagement publicly on policy positions. I think the same would apply here. What I would say is we as a board would like to show up in the right ways. But I also think we really trust in each other to sort of pass the baton. So one thing that's worked really well is, I think, coordinating with board members to say, these are some priorities where we need some board participation, but not everyone necessarily needs to participate. And we can, send an ambassador from the board, right? So we've got one person anointed to X, and it sort of just spreads out, frankly, the time element of this for everyone's busy schedules. So I would love if we could, to the extent possible, really coordinate around who has the time, the interest, and making sure that for those areas where we really feel strongly that there should be a board member there, that we're activating around that and coordinating. Does that make sense?
Yeah, that makes a lot of sense. And I think this will be the kind of thing where, as we build out our calendars, our annual calendars around this, it will become more clear about when we could use that. And then also, looking more broadly at other places where the board is being asked to participate, we wouldn't want to overburden anyone's time.
Yep. But to your point earlier, sometimes having, and I heard Stephen's great points as well. I think sometimes to your point, having just board representation is actually very meaningful, regardless of the subject matter knowledge of the board member, right? So I think it's more of a political piece than SME piece, if you will. So I would really turn to you guys on all things, not just the policy development piece, to say having a board member in this room would be very meaningful. So, and I know you guys judge that well. So.
I mean, I'll add to that. I think in particular, I'm interested in the community engagement piece of it, just because that's what we were appointed to do, is represent the community. So as there are opportunities to hear directly from the community on that, then I think that would be of highest priority.
Excellent. Thank you. And I think that's it. Yep. Thanks for the time and discussion, and yeah, if you have time to fill out your areas of interest from that board packet, I guess by the next meeting, that would be great.
Okay.
Yeah.
When you need it.
I think just send it to us in an email.
Okay.
And then we'll fill out the forms. It was in there. Yeah, so an email what you're interested in, yeah.
Thank you for this work and engaging us. It'll be great.
Thank you.
Delighted.
Hey.
Okay, sorry, Lexi. I think we're on to item number 4, wrap up 2025 and 2026 agency goals and roadmap. I think you could have said that too, so sorry.
So
Just want to make sure.
on to
my
our
job.
next item, wrapping up 2025.
There we go.
Perfect. Yeah, did it. Great. So yeah, so what we wanted to do tonight was to talk a little bit. Well, we have made a commitment to really being more articulate about our goals in the year and being able to report back to the board around those goals. What we'd like to do today is talk about some of the operational goals that we had in 2025 and the progress that we made, and kind of what our plans are in 2026 in those spaces, and also give you an update on our roadmap and our proposal for the roadmap going forward. In April, we'll be doing more of a programmatic review when we have our baseline KPIs collected, and we have our full-blown structure that has been discussed with the strategic planning committee. We've had our strategic planning retreat, and we'll be able to report back really on kind of the programmatic work and the KPIs in our draft 2026 targets. So in relation to tonight's discussion, I really I was trying to create some consistency, and so I took the goals that we agreed on in August, and I kind of took a look back and a look forward in those categories. And things actually matched up pretty well. Next slide. So one of the first goals was strengthening our internal systems and accountability. This was, I think, something that we felt would really help stabilize the agency and improve our ability to maintain institutional knowledge. We were having a lot of turnover, to have more standards and procedures codified, and to really make sure that everyone had the support that they needed to do their jobs well. So in terms of advancing agency performance, we were able to develop an agency performance evaluation framework, which we'll be presenting to you. And in 2026, we're going to be collecting the baseline KPIs. I think that happens this month and next. And adjusting the framework because we know that some of the structure and staffing has shifted since last year, so we'll need to make some adjustments. Performance evaluation down at the staffing level. We have our system in development, and we are now working on implementing the system. We also have adopted agency agreements about how we show up with each other, and are continuing to ensure that those agreements are understood and followed. We have engaged coaching for managers, and we will continue to provide staff and supervisor trainings and coaching for managers. The supervisor training is of particular importance, and Indira will talk more about that in her part of the presentation. what we have found across the county, not just in public health, is that training is very uneven and supervisors have very different ways of managing and evaluating. And we just want to make sure that everyone's kind of working from the same page a little bit more. We'll also be refreshing the agency's onboarding process and making it much more robust. That's something Amanda's working on. And we feel that that's really important because it'll give people kind of a better start out of the block when they join the agency. Efficiency and revenue generation. We had over 50 efficiency and revenue generation ideas from our staff. We did a lot of training in lean processes, soft cost analyses, and this year we're going to be prioritizing those ideas. And I think we should aim to implement 3 in each category, or at least begin to think about how we would implement 3 in each category, and continue the skill building and lean applications. Next slide. In terms of communicating a vision and building trust across teams, we really, I think we're doing a much better job of communicating where the agency is going with staff and building a common base of knowledge about how we're going to get there. Not just in technical terms, in terms of the KPIs, but also in terms of what our agency is about in relation to the community. We also did some training on restorative conversations as part of our effort to build trust across teams. And in 2026, we will, as we've said, we'll be kind of continuing to build out that plan, that vision, utilizing our KPIs and priority-based budgeting process, and learning from the achievement or non-achievement of our KPIs as we go forward. Indira is going to present on reinforcing the agency culture we need, which is the culture plan within the roadmap. So I'll defer talking about that. Advancing public health through strategic partnerships. In 2025, I think you all know that we hired Tessa. We also hired, engaged a community engagement consultant. We have already started building relationships with state and local lawmakers, created a plan for community engagement. We have identified a customer relations management system that we think is going to be extremely helpful in relation to our policy work and our community engagement work to help us stay coordinated so that our right hand knows what our left hand is doing, so that we can do much more quick communications without having to work with individual listservs and things like that. We also launched our annual report for the first time. In 2026, we're hoping to choose 2 local policy and systems change issues to be working on. We're engaging with the state legislature. We will be implementing the community engagement plan, particularly in terms of infrastructure and staff training. We are currently working on the contract for the CRM. Hope that'll be up and running pretty soon. We also will continue to coordinate with health systems, particularly around issues. We've been talking about a campaign around really engaging the health system and talking about immunizations. We feel like they're a trusted source. And so we're talking with Dr. Belknap about what that might look like as a regional effort. In terms of the BOCC, we hope to finish the IGA. I'm planning to do quarterly PMIs with the commissioners again. Those kind of fell by the wayside, but I think that they're really important for that contact and communication, and coordinating with them on if there are future budget reduction needs. We definitely would like to be in the conversation about where those are being targeted if they affect public health. I'm working with NDPH. I'm the co-chair of the steering committee, and we're going to be kind of redefining that group's vision as a regional group. And we will continue the annual report, and we plan to start a quarterly community newsletter that I think will be very helpful. And we're getting there. I'm not going to go through this line by line because we have talked an awful lot about building our fiscal systems for sustainable public health, and I know Armando is going to touch on it later. or at least the ANF team will. But just in terms of the progress that we've made in terms of budget sustainability and forecasting is enormous in the past year. We feel very confident about our ability to continue to do that work. And we have also implemented a significant number of internal controls to make sure that, there aren't single points of failure, that we all know what the information of record, where it's held, things like that. In 26, we will be looking at time and effort controls, desk manuals, automated change of status forms, just efficiency. And then we're also doing quite a bit of training with our staff on kind of some of the ANF technical aspects, like really getting a good scope of work down for your contract, because that is often what holds us up in getting those through, or making sure that everyone's still familiar with the equitable hiring process or other kinds of personnel issues. Okay, and my last slide is started thinking about the draft committee goals for 2026. We have 3 committees, as you know, the ED Oversight Group, the Strategic Planning Committee, and the Governance and Budget Committee. I think that one of the main goals of the ED Oversight Committee this year is to look at whether the board wants to simplify some of the process or change the timing of it. In terms of strategic planning, we're just kicking off that work. So we'll be talking with the committee about what we want to focus on this year and how the pieces fit together at our next meeting, and beginning to present some of the KPI framework and information to them. And then in terms of the Governance and Budget Committee, we'd really love to update the bylaws. There are some things in particular. For instance, we need to add a policy on policy priorities. Who makes decisions about BCPH's policy priorities? We also want to make sure that the board knows what the performance evaluation results are and has a chance to kind of unpack those and talk about the implications and what that means for decision making for the next year or learning. And finally, really taking some of those deeper dives on budget and finance topics, obviously. And Indira, are you on?
I am. Apologize for not being in person. I had a nasty cough that I didn't want to share with you all.
Thank you.
Happy New Year, everyone. Before we move forward, are there any questions for Lexi on any of this? Okay. Next slide, please. So in your Board of Health packet, you should have received a summary of both the roadmaps and the workload guidance plan. And just trying to describe and kind of give you an overview of everything that we accomplished. So I'm not going to go into too many details about it. I will say that, this was the second roadmap that we had institutionalized. It ran from July of 2024 to the end of 2025. And it really covered just the larger operational agency goals. So that's why it's a little bit different than the strategic plan. It's kind of our everyday work that we need to do, the systems build outs that we need to do. And it had the 24-25 roadmap had 4 main areas. One was to prioritize and align resources, really look at increasing those sources of revenue and workforce capacity, improving our organizational culture and continuing the collaboration with other county agencies. And we accomplished 75% of the tasks that we included in this. And this included large initiatives like the priority-based budgeting. We worked with the county to explore Medicaid, building a Medicaid system for the county. And that is something that will roll over into this next year. We accomplished hiring our critical positions. We rolled out the workload guidance and accomplished a lot in the health equity coordinating goals. And then lastly, just increasing internal communication with staff. And so what we decided for the moving forward is that we're actually going to pull out the finance and budget components of the roadmap, since they have kind of a separate process and project management plan that they're doing. And so, next slide, please. So this next roadmap, which kicks off in January, we will start to transition from the North Broadway campus to the 28th Street Hub in Boulder. So, as you know, the county purchased a new building at the 28th Street Hub, and so we're going to be moving over to the new building, and that's a big move because it will actually reduce the amount of space that we have and consolidate some services. So we'll be focusing on that. We are also working with Amanda in personnel to update the guidance and systems for recruiting interns, volunteers, and senior tax workers. CU Boulder has initiated an undergraduate program in public health, and so we're updating the contract with them. That contracts is actually finalizing that with them, and then we will be finalizing a guidance and a new system to actually get folks in the door to support. And these interns become really important for us as we've lost capacity. They help to do special projects. We will also be rolling out our staff evaluations, again, working with Amanda and the personnel team to develop and implement those evaluation plans for all staff. And we're looking at April and October, with April goal setting and October evaluations. We'll be developing and implementing some 360 evaluations, starting with the management team and looking at possibility of expanding that to others in 2027. Next slide,
And we've
please.
already done 3 of our management team 360s.
Yes, we have. Yeah. Next slide. So the fourth main objective that we have is improving our organizational culture. So when we went through the priority-based budgeting process, our management team identified the need to really rebuild and refocus on our agency culture. So we held 2 retreats in the fall of 2026 to really identify our culture, objectives and tactics, and just to make sure we're all on the same page. You know, our agency culture is defined by those shared values, beliefs, behaviors, and norms that really shape how we interact with each other, how we make decisions and approach our work. And it's essentially the personality of the organization. And so we really view 26 as being an infrastructure building year, and strengthening our organizational culture is really going to help us move to those innovative spaces, which we want to move to towards 2027. So this organizational culture focuses on building a culture of inclusion, bridging, and belonging, which we will be conducting through creating opportunities for folks to come together and learn about different topics. And Keith Rawls, who's our new racial equity manager, will be moving that forward. We're also talking about how do we build a culture for healthy conflict navigation. You know, everybody manages conflict differently. And so what are the tools and resources that all of our staff and supervisors need to manage that more effectively, so that things don't rise to the level where they didn't need to rise just by having conversations. As Lexi shared, we are really focused on a uniform and equitable supervision, making sure that all supervisors have the skills and are equipped to make sure that they are equitably applying their supervisory skills. And also, the big thing that we're going to be focused on in February is the culture of accountability. So really going back to making sure, you know, we lost 31 positions, right? So we need to make sure that we know what everybody's roles and responsibilities are, identifying gaps, and also building those operational plans. And this is important because there's work that, you know, people may feel like they have to do, but do we need to do it? And so we're trying to move the culture away from doing less with more, and actually starting to scope the work and do the work that they need to be doing. We're also going to be focused on a culture of celebration, so really focused on all the great work that we've done and making sure that we take time to celebrate each other and the work that we're doing in the community. And then this last one we'll be talking about at management team is just strengthening that learning and growth. So as Lexi mentioned, there's a lot of trainings that we're going to have to be doing The county moved to new systems for contracting and purchasing. We just need to make sure everybody is moving in the right direction, knows how to write that scope of work for contracts and things like that. And then the last objective that we have is systems of justice, or systems for justice. And these just recognize that, we've got work happening in the racial equity space, the health systems and policies change space, which Tessa Hale is leading, and then the community engagement space. And so all of these areas right here are having infrastructure being built out this year. And so by staying focused on these, we're making sure that our infrastructure is coordinated, complementary to each other, and not duplicative. Next slide, please. I'm really pleased to say that, we started working on workload back during the pandemic with the supervisors, and the supervisors built a workload guidance plan that we rolled out starting in January of 2024, and we accomplished 85% of our tasks to address our workload challenges. We focused on conversations that help staff to understand how to leverage technology to block off time. We focused on how to prioritize work, what's important, setting boundaries on work, how to run better effective meetings, and that includes we set policies for bringing people back into the office, but also understanding what are the best practices for in-person meetings versus hybrid meetings. We held a series of conversations with our supervisors regarding power and boundary setting, and we also identified through our management team discussions on workload that we really needed to reduce our last minute work and plan better. And that helped us to identify some of the infrastructure needs that we have. So really focused on really laying out the plan for 2026 and making sure that everybody knows what their workload is. And then the largest investment in 26, because we will be finishing this workload plan, but what has been rolled into the roadmap is really looking at resetting that culture of doing more with less, and working to scope the needs for what our community needs and what our funders' needs are. So really kind of just focusing on narrowing down the scopes of work. And I think that's it. I'm happy to answer any questions.
Well, I just want to make one comment before you go into questions. Something that's implicit but that we didn't name explicitly in this presentation is that we're really asking teams to develop their operational plans that are tied to their KPIs, and then building out kind of what the key deadlines are for achieving that. And then building it all into an accountability spreadsheet so that we can make sure that we're kind of staying on task, and that people, if they're falling behind, that we can kind of troubleshoot and say, what's happening here? Are you doing okay? Do you need support? What needs to change? And it's part of the reason you're seeing a little bit of duplication between my presentation and Indira's is because we're still pulling this all together. And the plan is to incorporate some of the roadmap components into kind of this broader plan, but it will encompass everything. And it also is going to help us scope the work, because what I'm seeing so far from our teams is that they take on too much. And it makes it impossible for them to deliver everything that they're wanting to. And so really being able to help prioritize what's the most important stuff in the community, I think is going to help us with the workload, with the accountability, with the ability to communicate what we've achieved, and also the connectivity between the pieces. There are a lot of components in this, internal as well as our programmatic work. So it's exciting, and it's a huge undertaking that we've been working on for a number of weeks.
Yeah, and to Lexi's point, we'll be launching a lot of that starting in February. So we'll have a better sense of how the interconnectedness is all tying together probably by the end of March.
Lexi, can you help me understand, or Indira, or both, how the operating plans connect to the strategic plans? Or Kelly, question for you maybe. How is that still a work of, like, how are you guys thinking about that?
Want me to jump into that a bit, Lexi? Sure. Okay, sure. So when we look at the KPIs, right? So different programs, they're all developing their KPIs. And so we're looking at KPIs that roll up into the work areas, into the strategic plan, right? And so when programs develop their operation plans, they're going to need to incorporate those KPIs into their operating plans and try to measure those. And if they can't, there has to be some negotiation, like how, what are we looking at, or does this make sense or whatnot? But that doesn't mean that's the only thing that they're measuring. They'll probably have additional KPIs that build that they're looking at as their program for what are their lessons from their program, how does their program work and things like that. And that'll also be helpful when we look at, for example, measurement spaces within a budget. When we look at, when we're looking at budgets and performance, that's also going to be helpful in this space, right? And so they're connected in that space. So the KPI should be, we're getting feedback by the 30th. We're getting from the KPIs that we send out to programs. Then we're going to be sending and finalizing those KPIs based on feedback more or less the first week of February. And then we're going to be getting to finalize KPIs by later in the month and February. I think it's the 20th or 21st or something like that. So Indira is working with those teams on their operating plans. So it's our ability to incorporate those pieces. Is that helpful?
Yeah, and I assume that there's some subset of your KPIs that are strategically oriented and there's some that are much more kind of programmatic or operational. So not all of them will flow up to the strategic view. Is that right? Just so I understand, the purpose of the operating plan is to operate the unit. And there are some things that are more strategic in nature than others. Is that a fair way to look at it, or is it different than that?
So we do have the strategic plan indicators, right? That it's a complicated piece, right? Because we have these work areas and the strategic plan is part of this work areas, right? But there's a bit of different measurement between those. So yes, we have plans in place where they may roll up to one. They may roll up to both of those, but they eventually rolls up into these work areas, into our objectives, including if we look at eventually, if we start looking at population objectives and things like that. So does that make sense?
I think so. I'd be interested to see an example of getting
sure.
developed just so I understand. I'm just trying to understand how this all knits together in terms of the aggregated performance assessment, right?
So let me give it a shot too.
Please go
I
ahead.
can do this offline. I mean, I don't want to,
No, it's okay.
read
I
it.
this will be quick. So you all are familiar with the strategic priorities.
Yeah.
Those are the areas that we felt like we needed to dig in deeper to be able to achieve our goals better. And we also recognized that we needed a way to assess the performance of the entire agency. And so we identified 6 work areas that encompass all of the work across the agency. And the strategic priorities fit nicely within those 6 work areas. And the strategic priorities already had KPIs built out. And so what we've done is for each of the work areas, I'll give you an example, communicable disease. One of the core responsibilities or strategies is to monitor disease in the community. That's very nicely tied to our communicable disease team. But there are other kinds of strategies within each of those work areas that might cross multiple programs. And so we're making sure that each program has a KPI, but that we're also able to represent kind of an agency level indicator for that strategy.
Okay.
Does that help?
It does. Are there measures though that are less sort of programmatic or strategic and more operational efficiency?
So our governance, we have governance and infrastructure.
Yeah.
That,
Okay.
Yeah, captures a lot.
Okay.
The operation.
So there's different buckets of types of measures. I'm sure some are leading, some are lagging, and then some of them will float up to the strategic view.
Yeah.
They'll aggregate to the strategic. Okay.
Lexi, Lexi, this is Steve. If I can just follow up with that question. I was a little bit confused and a little bit concerned. obviously, what you're describing is very complex. It sounds multidimensional almost. I think it'd be very helpful, at least for me, if you start identify one specific area and kind of work through that area before you tackle everything at once, just so that we get a sense of like how these various KPIs and goals and objectives and strategies are linked. You know, whether one is say one is a goal and one is more of an operational description of what each individual or team has to do to achieve those goals or not. So is it possible for maybe somebody to kind of pick a specific area? You mentioned communicable diseases or something like that, or even something even narrower than that, just to identify a topic and kind of work through that area to describe these various things and how they link to each other before the whole group goes into this very complicated and broad set of objectives.
So that is exactly the topic of our next strategic planning committee meeting. So excellent idea.
Okay, thank you.
Any other questions?
I have a logistical question just about the move from this campus. Where are we going to have our board meetings?
Don't know yet.
Well, probably, there's a lot to tackle in that space. So we're just waiting to see. We're kind of dependent on the county is running that whole transition.
What's the address of the new building?
25, 28th Street.
Yeah. I just want to mention something, and I hope that this might help, Lindy. So like when I worked in healthcare, I was a infection control officer, right? So I had my own programmatic objectives that I was working on, and I might have one or two KPIs that rolled up to the quality assurance, so they rolled up. And then it kept rolling, those kept rolling up. And so I think that the operational plans is something that some of the programs really want, because it provides kind of that project management of what they're working on. And within those operational plans, they will have key performance indicators that are really important to the work that they do. And so I think of the op plans as really the baseline project management for those programs, and then having the KPIs as, kind of the more North Star. And so by having that direction, I think it's going to keep us super organized and keep us focused, which I think is very important for a lot of our programs.
That is perfectly said, Indira. I appreciate that.
Yeah. If you work in healthcare, you know what I'm talking about, because there are certain quality indicators that will roll up and you're constantly measuring and tracking. And so I think those KPIs are going to be those, quality control measures that we'll be evaluating all the time.
You also don't want 5 million measures you're looking at, right? Like you want a very clear dashboard that's a balanced scorecard.
Yeah, and the programs also want to have some structure, to their programs too. So I hope that helps.
That helps a ton. I appreciate that.
I just want to also, before I end, just say that this roadmap and the workload was a heavy lift among the whole agency. And so I think everyone in the agency should feel super proud of the work that they've done. And it was led by many different people, and we accomplished a lot in the last year and a half, 2 years.
Yeah, I was going to make that comment as well, just leaving in all of the what you did in 2025 and what is now being targeted for 2026 is just a really good reflection on the important work that's occurred over the past year. So another thank you from me, I assume the entire board, for everything you guys have done to get us to this point, and then also the planning for this next cycle, which I really appreciate. So thank you. It's been a fun year.
Very productive year.
A productive year.
Yeah.
A hard year, but a good year from many different aspects. Item 5. Aha. Oh, I don't want to do this one. We're fine.
We don't start with that, so you're good.
We're sadly going to be talking about our ANF Director Transition Plan.
I don't think that the agenda was updated, Patrick.
It's administration and finance update. Yeah.
Yeah.
That's what we have now.
So not your fault. It was, we need to update that on the agenda.
Yeah, that was an old cut and paste. Sorry.
Good evening, I'm Desiree Kazarosian, Finance Manager for Boulder County Public Health. I will be presenting an overview of the Finance Department for 2025, including a preliminary overview of the fund balance. Sarah will conclude with presenting the budget status and plan for 2026 and 2027. Boulder County Public Health was an innovator in the development and the implementation of priority-based budgeting.
Next slide.
Oh, thank you. In Boulder County, we presented PBB at the CGFOA conference and have received several requests from other government agencies asking for our methodology, which we have shared in a template. We have offered to walk these governments through our process if interested in pursuing this budget method in their own jurisdictions. In 2025, Finance stood up our grant office and created a grant intake form for divisions, and we are currently developing a non-grant intake form. This is part of creating a tightened finance infrastructure in 2025 that also included the development of several policies and procedures. All 2025 audits were completed with no findings. Next slide. Here's our 3-year fund balance projection starting with 2026. Total is preliminary and not yet final. Per our policy adopted in April of 2024, BCPH is required to have a fund balance of 15% with a maximum of 20%. From 2026 through 2028, BCPH is anticipated to have sufficient fund balance to maintain these levels. As shown, the agency will begin 2028 with a 15.24% reserve. Following the PBB zero-based budgeting framework, we will remain solvent and fiscally stable for the next 3 years. A footnote is showing possible additional funding cuts from Boulder County that may affect the yearly Boulder County transfer to public health in 2027. Any questions on those 2 slides?
No, I was just going to say, I mean, one of the take homes for me is that we were really able to conserve the reserve this year, which is really helping us put us in a position of sustainability for 3 years now, not just 2.
Yeah. And that's more firmed up since the last meeting, correct? Yeah, because
Yeah, we have preliminary December numbers now for you. Yeah,
that's great.
Really excellent work. So thank you.
We're showing 28. I didn't show 28 because I was waiting for, so you can see now we're the next 3 years very sustainable.
We're on a good path. Yeah, that's great, you guys.
Yep. Okay, I'm going to turn it over to Sarah DeBoer, our senior budget.
Landry and Stephen, we will put your 2026 budget books in the mail. Your copy for late night.
Thank you.
And just while those are getting passed out, I just wanted to say how amazing it is that you guys just got this methodology published in very important places and that others are using this methodology to think about how they are sustaining their public health infrastructure as well. So I just kudos to this whole team. This was a major undertaking and I love that we're getting public recognition on top of that for that. So well done. Thank you.
I'm Sarah DeBoer. I'm the senior budget analyst here at the agency. This slide gives you a quick overview of where we are at as far as implementation of 2026. We've been talking about development for 15, 16 months, I think, since I got here. So we're finally at implementation. We have provided the budget and personnel allocations to all of the divisions and programs. Those went out just before Christmas, so they were ready to start moving on that. The budget book that I just passed out has been submitted to the Government Finance Officers Association and accepted. It is now in the queue for scoring. So we are working towards that golden budget award again. It has also been submitted consistent with state statute with the Department of Local Affairs for the state. It will be available once Boulder County submits their budget book. We are well ahead of the curve on that one. So the 2026 budget book includes everything that was in it from last year. But we did look to our friends at El Paso County. They have won the GFOA award, I want to say, for probably the last 10 years. So we took a page literally out of their book and made ours quite a bit more robust. I think last year it was about 60 pages. This year it's about 100. So we really went back and looked at an organizational overview, including, you'll see in the book, there's a 2025 org chart and the 2026 org chart, so you can see what's changing. We've included your bios. Thank you for allowing us to do that. We have included our agency plans, our grant development opportunities, awards, and recognition. And then as you flip through the book, you'll see when you get to the summaries of each division, we have outlined significant changes. So changes in staffing, changes in programmatic delivery, things like that, so that you can see what's different. And then in 2026, we will continue to provide the monthly financial reports that you've become accustomed to seeing. So happy to, as you go through that, let us know if you have any questions. There's a lot of reading and a lot of tables and charts that we've really tried to make it easy for the public to be able to understand our finances and our budget.
Hopefully it'll be such a big lift every year, right? Yeah. Drafted something similar.
Plug and play.
Yep.
Hopefully. Next slide, please. So for 2027, this is our budget framework that we are looking towards implementing. One of the things that I have heard fairly constantly since I started here in September of 2024 is that the budget process changes every year. We're trying this year to really, for 2027, build on the work that we did for 2026, which is your priority-based budgeting. So we'll continue to build that out using the scorecards, the fiscal matrix, the personnel allocations and whatnot as we move forward. However, what we are adding to that for 2027 is zero-based budgeting. So this is justification of funding in targeted areas. We're working through how that implementation works, but making sure that what we're funding, we understand the cost and then starting to work towards that ROI on this is what we're paying for it. This is what we're getting out of it, which is where we will be very closely aligned with Kelly's health and performance evaluation team to make sure that we are sharing metrics and using those consistently across the agency. This will also allow us to maintain discipline and accountability without creating an unrealistic workload. So consistent with what Endura had presented about the workload plans, we want to make sure that what we're asking for from a budget process is aligned with our operational plans. So finance is also becoming more engaged in that area of work. A lot of this cross-agency work with the ANF and SIB teams. In the coming weeks, we will be sharing the 2027 budget calendar with staff, as well as with division managers. We will be doing a budget kickoff the second week of February with the division managers, the program supervisors, and the program coordinators, walking through that calendar, understanding roles and expectations. We've used a RACI matrix, if you're familiar with that, to help people understand based on their role within the agency, what the expectations are from them for the budget process. I'm hoping that that also helps an understanding of workload and time investment. And then we're also working on developing templates, communication strategies, and whatnot based on feedback. We did what I would call post-mortem or a plus delta exercise after the 2026 development process to understand what worked well, what didn't work well, and what we might want to tweak. And so we're taking all of that feedback into consideration as we build for the 2027 budget process. So that is where we are at, and I'm happy to answer any questions as you see fit.
It feels like a really robust process, but it's mimicking what we did last year without the need to like build the PDB framework from scratch. And because we're using zero-based budgeting, the budget should be fairly straightforward. It's really a matter of making sure that we know where revenues are going down and where new grants may be coming in.
One thing that might be helpful for the board is just similar to the calendar you guys are launching with the staff. If you could also remind the board what the calendar is.
Well, you'll get a copy. You can share it, so you
Great.
exactly know where.
Yeah, just so we can follow along and remind ourselves that we've been through this now, except for Steve. And I think, you know, just making sure we can also talk about it in the subcommittee.
Yeah. And I think Armando had showed you a cadence of meetings a couple of months ago. And when I built and proposed the calendar, I aligned that with your subcommittee meetings, your various retreats and whatnot. So that's already taken into account as we're building that out.
Obviously, we will see what happens with the OFM calendar, but it's also based on the current OFM calendar. We'll see if that moves, but we'll make adjustments as needed.
Hopefully we have some influence there.
Yeah.
I think
I
Armando.
think that's a good example of kind of this bigger planning that we're doing this year that's much more robust than we have been. Yeah.
Yeah.
All right, well, I just wrote a little quick farewell script, and I just kind of want to read it and just want to thank everybody. So I just want to take a moment to thank the board and obviously the staff. Serving as the Director of Administration and Finance for Boulder Public Health has been one of the most meaningful chapters in my career. I've been a public servant for, 15, 20 years now. Small agency, but really was very meaningful. I walked into public health not knowing, I knew what public health was and I knew it existed, but really learning a lot from everybody. I stepped into this role during a period of real uncertainty for this agency, really from day one. And together we brought some stability, clarity, and strong financial foundation to this organization. I can really walk away saying that I see the next 3 years. I've given a good transition plan to Lexi. It's really just following it. I really believe the next 3 years should be, it's not going to be super innovative and growing, but it's very stable for the next 3 years. What I'm most proud of is isn't just the numbers, it's the culture that we built around transparency, accountability, and thoughtful decision making. That was big. As you can see, we like to be humble, but we've been out there in the state and people are actually looking at the process that we built. So it was very thoughtful. And I think it really does that transparency and accountability. We create a system that allows leaders to see what happens, ask better questions, even from the board. You were very engaged with us from the beginning. We started looking at priority-based budgeting, and we usually do one retreat a year. We've had 3-4 retreats. We've been, taking your time. Your time is precious, but that really helped us build it forward. And also, you asked better questions. I think we provided you with good data to be able to ask those good questions. You made choices grounded on data, and it wasn't a crisis. I think that was at first I felt very, fire, but I think towards the end we really got better at, addressing the crisis with data. So I think that was a big accomplishment. To this board, I just want to say, thank you for the trust. Lindy, at first I was like, hey, this is what it is. And you're like, well, show it to me. It's like, just believe me. You're like, no, show it to me. And so I appreciate the trust and the partnership from the board overall. You've been very engaged. This wouldn't have worked if it wasn't from your direction and your support. And then also Lexi as the executive director. Those were the important heads that needed to give us the power, I guess, or the support to keep us moving for this agency. So I think, I want to thank you on that. And the willingness to engage in hard conversations. We had difficult conversations with the board. I've had it with the division managers. We talked about this position today earlier, and I think this position needs to have somebody that can say no. I don't like saying no, but I think it's part of the job. So hopefully you can find somebody that's willing to still build relationships, but still be able to say no and keep this good relationships. You're consistently showing up for the agency. Y'all are, we show up on Mondays and even on these retreats. I know you have busy lives, but you're very supportive. That was important. I think that was important to show to the county. We had to build a lot of relationship building with the county, the commissioners, and I felt that was very important. So you made it possible for us to move it to this direction. So very thankful. And then obviously, I think the staff of public health itself, really resilient. We went through a lot of change. Everybody knows the positions we've lost, the reductions, but I think overall, we hear about morale, but I think overall people are happy at the way we did it. We've heard it from other departments from the county. The way we did it, I think, was strategic, was very thoughtful, and was, keeping staff in mind when we made these decisions. So that was important. To the leadership and staff, I'm greatly grateful again. You carried an incredible workload with professionalism and heart. The agency is, I think, in a better position than actually when I walked in. I would have to say there's accountability, transparency. We're not perfect. Any organization you walk into, there's always opportunity for process improvements. I'm walking into a new OFM. I don't know what to expect. I'm going to look at the data. I'm going to do the same thing I did here, and learn, listen, and ultimately, hopefully find, process improvement. And that's any organization. If you're going to be a organization that is high caliber with the culture of innovation. So, well, I'm stepping away for this new role as the CFO for Boulder County. I'm not going far, so remain committed to supporting Boulder Public Health and the mission you serve. I truly believe it, and I look forward to continuing to work together within this next chapter. So thank you for the opportunity for serving, and it's been an honor.
Well, Armando, I'll just kick it off and first and foremost, thank you for everything you've done. You have shown insane leadership in a really hard time, and you stepped in. I remember the first meeting where you spoke. It feels like it was yesterday because it kind of was. And your ability, what you did in such a short amount of time in terms of your leadership and your effectiveness, and working closely with the board on what we had to get done was tremendous. So personally, thank you. I also just thank you to the staff, because I know that this wasn't you alone. This was a huge team, not just, the finance staff, but the whole organization that rose to the occasion to get this done. And I really appreciate what you said about culture, because, you can have a good idea, something that we have to get done, but if you can't engender the support to execute against that and really think about the culture and how people need to align, and drive, and from a leadership level, driving that, Lexi, it's impossible to actually do. So thank you. We are going to miss you, and I am personally going to miss you, and so glad you're still in the county. So your talents can't go anywhere else. You have to continue to help Boulder County. But thank you, truly.
Thank you.
Thank you for everything.
Yeah, and I will add, we're so appreciative of your leadership and to the whole team who really rose to the occasion, and we needed it. And I think not only does the board feel relief being in a much better place in terms of understanding our budget and also feeling like we're in a good spot for sustainability, but I think also we just feel this pride in what the organization has been able to do, and I recognize you, Armando, and Lexi, you also for stewarding what has been a very hard process, and to the whole staff for rolling up your sleeves and getting this done, because I think we have said this throughout the year, but we feel like we're in such a better place than I think so many other local governments who are really struggling with what their financial picture looks like. So thank you.
Thank you.
And I do really quickly just want to call out Brooke, who's no longer on the board,
Oh, yeah.
but she was so instrumental in moving us forward from the board perspective on this topic. So I just want to say thank you, Brooke, even though she's probably not listening.
Well, and I will say, Armando, it has been an absolute pleasure and delight to work with you. I'm sorry it was only a year, but I wrote in the book, I hope that this is just the beginning of our professional relationship and our friendship. You have been just a really stand-up guy. You've done this job with a lot of class. It's a hard job. And you have really supported your team and brought them skills and talents and given them opportunities that I think have really excited them, and that in itself is a gift.
Thank you. Thank you. Oh, that's it.
All right.
Thank you.
We'll be reading this.
Yeah.
Thank you all. It's really beautiful.
Sean Hollister did the translation of Sarah's beautiful vision into the paper that you see in front of you with the images and the layouts.
It's
And
really beautiful. I
he did
mean,
it.
see how deep I can get into this. One thing.
I break it into.
Yeah, I'm gonna take it in chapters. I think. Okay, all right, we're on to the director's report. Lexi.
I just want to mention a couple of things. It has been brought to our attention that we need to have a policy on who approves our policy priorities at BCPH. So we'll be presenting something to you next month so that we can get that on the books sooner rather than later. The second, well, three things. The second thing I want to mention is I think you read what happened during the PSPS. So what happened was we had this, pretty great contingency systems, backup systems to make sure that our vaccines stayed cold. They all failed during the PSPS. But our staff is so dedicated, and particular shout out to Bob Jenkins and the immunization team and the folks over in CEDAM. They caught it early enough that we had very few vaccine losses. It could have been, tens of thousands of dollars, and it wasn't. It could have been a significant problem with our license to provide vaccines. It wasn't. That is just such a great example of the dedication of our staff, and just, driving out in the middle of the night to go check this stuff and make sure everything's still intact, and just quick thinking and really organized. And that PSPS was a challenge in a whole lot of ways. There was a lot going on during that time. We had kind of multiple things going on at that time, but I think they responded really beautifully. I believe we have 3 strains of flu right now in the community. At least one of which is not well matched to the vaccine. I think I've had 2 of them so far. So yeah, be careful out there. We're still in respiratory season.
And Lexi, just on that point, this is just anecdotal, but I'm hearing seriously everyone I know has gotten something. Are we seeing like spikes or trends that we should be aware of that are outside of the norm? Do we know? Is it too?
I mean, Colorado was leading the nation, right? Us and New York in terms of.
Yeah, I think the incidence is pretty high, but Boulder County has like the first and second highest immunization rates in a number of those respiratory categories. So, I mean, we're better protected than other counties, but those vaccination rates for the flu are like down in the 30s, right? That's a good vaccination rate. So, it's. Indira, do you know if it's still trending up? I'm trying to remember the slide from CDPHE the other day. Where's Stephanie?
Yeah, it was still
So
trending
this
up.
is Stephanie.
Yeah.
Oh, sorry. This is Stephanie. I was just going to say that I believe what I've recently seen is that it is finally beginning to trend downward a little bit here in Colorado.
Okay.
Good to know.
Lexi,
That's all I have. Oh, yes.
Just a question about the cold chain issue. I guess I'm kind of surprised that there wasn't some kind of a robust backup, in the situation of power outage. Will the new facility have anything a little bit more robust, or do you have any idea?
So we had a couple of backup processes, and we are actually doing kind of an after action review to figure out where the fail points were with the county facilities, and to make sure that, for instance, if the electricity goes out in the building, it doesn't prevent the alarm from contacting our staff to tell them that the temperature at the fridge is declining. In one case, one of the failures was that a generator stopped running because it ran out of oil. So I think that there are some great lessons here. And we'll definitely be taking another look at what the planning looks like for the new building.
Thank you.
But to answer your question, yes, Stephen, the new building, all the refrigerators will be on the backup generator. So it was just a number of challenges where the generator failed, the temp guard was on the network instead of being on a landline. Anyway, and then the network went down. So I think it just goes to show you how fragile we are. I mean, the good news was that when the immunization team contacted the state was very understanding, because that is a very big worry when you are a vaccines for children provider. And so the state was very understanding because it sounds like it happened in other counties too.
And big thanks to Boulder Community Health, who allowed us to store the vaccines over there very rapidly, gave us permission to move the vaccines over.
The team has a emergency storage agreement with BCH and Bloomberg Health.
Okay.
It's our third level of backup, and that one worked.
We'll need to check the oil in the generator, maybe.
Yeah, I think so. I think that's a big one.
You want to put our nurses on it, they'll do it.
You guys teach me how to do it, I'll do it.
You want to add that to the bylaws?
Yeah, you could add my
Job
list,
description.
right? Lexi, anything else? Sorry.
Yes.
Okay.
Just wanted to make an announcement that Heather Crate is going to be moving to Adams County to become the Community and Behavioral Health Manager. Heather, as you all know, is the Division Manager for Community Health here at BCPH, and they've been here for 14 years. It was their first job, I think their first job out of college. Heather has had an enormous influence on our agency, on what our values are, on how we move equity work forward, led the OASIS team, which was an incredibly innovative program supporting LGBTQ youth for a number of years. And we're really grateful to them for all of the work that they did with BCPH, and wish them all the best successes with Adams County. Yeah, we'll miss her. Miss them.
Thank you so much, Heather. I don't know if you're on the line, but we're so grateful. And I know I've had the opportunity to engage a little bit on some of the programs you've been running, and they're incredible and so impactful. So, but we wish you much success in this next role. And at some point you do have to go and spread your wings somewhere else, right? 14 years is a long run.
It is. And that's all I have for you this evening.
Great. Are there any other questions about the director's report from board? Steve, I just want to make sure.
No, I'm good. No, thank you very much.
Okay, great. All right, and is there any old or new business or announcements?
Oh, that was
your announcement. Okay,
I think just a quick heads up, you'll be getting an email from me on scheduling all of the
thank you.
committee meetings.
Okay, great.
Lexi and I have laid out the calendar for the rest of the year.
Okay.
So I'll be sending that out, and responses will be appreciated.
On it, and then we owe the response to the policy ask as well. Okay. Great. All right. Well, there being no further business, this meeting is adjourned at 6:58 on Monday, January 12th. Thank you, everyone, and we'll see you soon.
There it is.
Did it, Avalon?